Yeah.
Go ahead.
Oh.
Hey guys. For Benar.
Thank
Do
you.
it Benar.
Hi guys.
There we go.
All right.
Wednesday, lesson of the day. So this is actually a perfect room to do this in. We've got an Ecuadorian who
Mexican.
thinks he's Mexican.
Okay.
He's from Mexico City. This is Carlos, our resident. We have Chopra, who's an Indian who thinks he's white. So kind of. Well, obviously Esther, thinks she's Mexican, but she's really from Ojai,
Oh yeah.
Oxnard. And then Benar,
Who?
well,
Go ahead. Go ahead.
well,
Go ahead.
you
He's
know,
what?
she's
There's
I
badass.
think she's got soul. She's got soul.
Thank you. Very
Well,
well said, doctor.
Yes. So today what I wanted to discuss in Spanish or English is ethnic considerations in facial plastic surgery. So ethnic considerations, meaning there is a difference between different ethnicities and how we look at them and what we do. And in this world of these millennials or whatever these Z people are, they feel like they're not allowed to talk about differences between people because differences are inherently bad, which is not true. Differences are differences, and people are just different, and there's nothing wrong with being different. And in the medical world, we're scientists, so we just state fact. And I will state some factual differences using things that we have noticed in not only aging of different ethnicities, but how we treat them and what the preponderance is of different procedures we do for each ethnicity. So, I will start off by saying, as you've noticed, plastic surgery is mainly for the aging face world, which is what I do, is mainly made for white people. And this is because white people in general, whether it's white of Ireland or white of the US or white of Australia or anywhere, or just lighter in color, tend to have thinner skin. And the skin, when we say thin, we're not just talking about the epidermis, which is on the top of the skin. We're talking about the dermis and then the connective tissues underneath. So they tend to be thinner as a population. So not every person, but as a population. And because of this loss of turgor and connective tissues volume over time, they end up sagging, they lose more volume faster, and they age more, a little more rapidly. And most of these aging face surgeries are geared towards them. And that's facelifting and upper eyelids and all these different things that we do in plastic surgery. So they tend to age a little bit faster. They tend to form skin cancers a little bit more because of their sensitivity to sun exposure. But the benefit is that when you actually do operate on them for these skin cancers, they heal better because they have thin, light skin. Now, there are differences between white skin types. There are thicker skin and thinner skin types, and that's why some people age slower or faster. The opposite of this would be black skin overall, and everyone's heard the saying, black don't crack, and there's a reason for that, is that genetically they're just better off as a population. The skin is more dense, overall does not form skin cancers as much, but the downside is that when the skin is cut, it doesn't heal as well. So these are things that we have to consider. A similar ethnicity to that is Asian skin types. Asian skin types, if you've heard Asian don't raisin, Asian skin types also stay young for longer periods of times. They maintain their volume, they maintain their thickness and density, so they don't droop as much, although when they hit like 60, 65, there's like a rapid decline sometimes. But these skin types that don't age much tend to scar more. So again, if you have an incision in Asian skin or in black skin, you do have to worry about what we call hypertrophy or keloids. And these are two different things. So keloid is the common name that everyone uses, like Kleenex. But keloid is like a tumor formation of scar tissue, of collagen. And what happens is you cut an area or damage an area in the face. It's most likely around the ear. And a keloid can form, meaning you start to form scar tissue that not only grows in the incision itself or where it was damaged, but around the area. And this is in piercings as well. And that's what makes a keloid notable, is that it spreads beyond the area that was damaged like a tumor. So it starts to spread, and it's in a disarray of collagen. The collagen is not normal type 1 or type 4 collagen. It's a preponderance of just one type that ends up growing more and more, versus a hypertrophic scar is a thickened scar, a little bit more organized, and stays within that area. So hypertrophic scars are easily treated. We use 5-fluorouracil to treat them, whereas the keloids are more difficult to treat. They usually require excision, cutting them out, followed by Kenalog or triamcinolone, which is a particulate steroid. It's a particle that sits in the skin and seeds in there and sits for a while and keeps it from growing, or 5-fluorouracil, which again is a chemotherapy drug that we use off-label to help stop hyperactive healing, pretty much, or swelling. The other thing that some people use is radiation. You can actually send them for electron beam or other forms of superficial radiation to kill the keloid, which we look at as a tumor. It is kind of a tumor. So it's an overgrowth of cells that keeps growing. That's a tumor. It's a benign tumor, but it's a type of tumor. So that's that for the 3 main skin types. And there's everybody in between. There's this guy over here who's kind of like olive toned and adorable. There you go. Yeah. And there's me, I'm kind of olive toned, and then there's this guy, he's kind of olive toned. So we all age similarly, which is we're in the middle. We're in the middle between white, black, and Asian. And plastic surgery is done almost the same for everyone, but with different considerations. So one thing you have to consider is scarring. Another thing you have to consider is volume loss. Let's say you do lighter skinned people, typically they have more volume loss. You have to think more about fat grafting versus we're doing black skin. There's not much fat grafting. They maintain the volume really, really nicely. Puerto Ricans, they fall into more that side of olive to black tone, and they also tend not to age as much. Now, let's say we're getting to rhinoplasties. Rhinoplasty, there's a whole field that we call ethnic rhinoplasty, which all it means is that you fall into some category other than white. So this is ethnic rhinoplasty. Doesn't mean you're any specific ethnicity. It is just white rhinoplasty is considered to be thin skin, strong cartilage. And then when you get to ethnic rhinoplasty, that means you're getting into overall thicker skin, heavier skin, and weaker cartilage. This could refer again to any ethnicity, but that's called ethnic rhinoplasty. It does not really categorize people properly because they all are different. Like an Arabic person would be much different than black, would be much different than Asian. All the structures are different, but they categorize it as ethnic rhinoplasty. So if you ever hear that, it's typically not referring to Arabic, it's referring to black or Asian noses, which tend to have thinner cartilage and thicker skin. So you have to consider these things, and when you do surgery on people with thin cartilage and thicker skin, you're typically doing something called more structural rhinoplasty or augmentation rhinoplasty, where you're building up rather than bringing down. Because if you take a nose that's thick and you decrease the projection or decrease the strength, the skin ends up taking over and it ends up looking fatter and heavier over time. So these are important considerations when you're doing rhinoplasty. And there are some surgeons who specialize just in one ethnicity. So not on purpose all the time. Sometimes their practice just goes that way. So you have people who just do Asian rhinoplasty or just do Asian blepharoplasty. There aren't many people, and this is a question I get all the time, say, Doc, why don't you have more black people on your page? And I get this all the time. And I say, well, it's because 90+% of people I operate on happen to be lighter because they're the ones more in need of plastic surgery. And they say, oh, yep, I guess you're right. That makes sense. So there aren't many specialists in the field of black plastic surgery because they don't need surgery so much. Black don't crack. No, it's true. It's like they just don't need surgery. They look great for longer periods of time. So these are genetic advantages. As far as like filler and Botox, same thing goes. They don't use as much filler or Botox either with those skin types. So the specialists that you see that are outside of just your general realm are usually the Asian rhinoplasty specialists. In LA, you have Persian specialists because there's a lot of us in LA, and that must be a fun practice to manage. Persians were fantastic. So they're big, yeah. They're fun to deal with. Persians and Israelis, good luck. Buena suerte. Then you have, there aren't many other types of specialists. But either way, I hope this was informative, that we do take into consideration different skin types, different ethnicities, because we all age differently. We have different structure. There are some things to think about differently between the different ethnicities. When you open someone up, if you're wondering if we all look the same inside, yes, we all look the same inside. Coloration of fat, musculature, and everything else is the same. It's just the connective tissues are different thicknesses and different consistencies. And the only people who are ugly inside are people who have been over-injected with stuff or too much treatments, too many surgeries, or things placed in the wrong place, and they usually look weird on the outside too, but that's not ethnically based, so not a consideration. So I hope this is helpful for people who have wondered about the differences between everyone. Question about Albanians. Albanians, they're genetically pretty good. Albanians don't age very much. Albanians and Lithuanians, interestingly. Yeah, so that part of the world ages very nicely, it seems. Mixed racial. Mixed racial also ages very nicely. Mixed racial, and this is most likely because of mixed genetics, is that mixed racial has less tendency to have recessive genetic traits. So mixed racial, they age very well in general. Jewish, depends. Are you Sephardic or Ashkenazi? So Ashkenazi Jews fall into the white category. They age rapidly, my friend. Lose a lot of volume around the eyes. Tend to sink over here pretty quickly at a very young age. They deflate around these areas. Obviously, we all know about the Jewish nose. So those are Jewish things. But then if you're Sephardic, which is the Sephardic or Mizrahi, which is the darker skin types in general, tend to age a little bit better. But they all eventually need help. Mexican, Cubana, they all fall in the same category. Depends just how you look overall. Sicilian, Italians age very well. Italians and Greeks have very dense, tight skin types. So Italians and Greeks tend to age very well. Italians do come in more for the large noses. They fall into the Sephardic Jewish category. And if you live in Long Island, they're actually all the same exact people. The Italians eat bagels and the Jews eat pizza every day. So everyone's the same over there. Lebanese, huge mix in Lebanon, so it's all over the place. You have light Lebanese with blonde hair, you have dark Lebanese, they fall all over the place. But countries like Lebanon do accept plastic surgery more, so you do have a lot of good specialists over there, fortunately. Turkey, Lebanon, Iran, all are very experienced in plastic surgery. Afghans fall into the same category as Persians, which usually age right in the middle of everyone. Filipinos do not age. Filipinos are like, they don't age. And
I have a couple of my friends that are like 50, 55 and look like 20, 25.
Yeah. Doctor.
Yeah,
Let's go to the party. I speak Tagalog. So, Filipinos don't age, and they're also like the nicest people ever. And if you ever want to have a kid who's going to take care of you when you get older, have a Filipino kid. So this is like, culturally, they just take care of people, and they're very nice, caring people. So definitely get one. Asian, German, Irish, and Portuguese. There you go. That's a winner. Asian, German, Irish, Portuguese likely will age very well. Indians age pretty well. Yeah, until they hit like 60. They're like Asian. So they hit 60 and then they rapidly decline from what I've seen. And they just go down all at once.
I mean, I'm old now. Pretty good.
Yeah, you are old.
I'm like 50.
He's 10 years older than me. Look at that face.
Look at those teeth.
Look at those teeth. Syrian also falls there. Irish, Mexican. Who knows? But probably drink a lot of tequila and whiskey. I don't know. No, I don't know about Irish and Mexican. Brazilians age very well because Brazilians have and it depends what part of Brazil. Northern Brazil does not age. So northern Brazil is predominantly darker when you get near like Fortaleza and those areas. So I doubt you have much aging there. When you get down to Rio de Janeiro, there's a little bit more, but you're still mixed on the darker realm. And the mixed blood in Brazil tends to not age so much. I'm coming right now. And then when you get to the south, now you're getting that Italian and Argentinian mix where it's a little bit lighter and they age a lot more. So most of the facial issues that you would have in Brazil are coming from the south, and then more of the body curvy influence that you have in the genetic blood pool comes from the north. I promise you that. So you're out of here? Okay. All right. Well, I got to go as well. I hope everyone learned something, that we are all different and there's nothing wrong with that. We can still love each other and all be great. Nobody's better than anyone else. That's very different. So I'll leave this posted just in case anyone's curious. And that is today's. And the reason this topic came up is because we saw so many people asking the same questions about, like, why does this happen to me but not my cousin? Why does this happen to me but not my friend? So I try to explain sometimes there's genetic differences, and those genetic differences could be ethnic or they could be just genetic in your family. So that is all. Hope everyone has a nice evening.